today's webinar, Preventing Suspension and Expulsion in Early Care and Education Settings, Your Role, Your Rights, and New Supports. My name is Chad Sievers, and I'm Project Coordinator for Arkansas Building Effective Services for Trauma, and I'll be your webinar moderator for today. Before I turn the presentation over to our speaker, I've got a couple of housekeeping items that I want to mention, and I'll introduce our speaker a little bit. Okay, so a couple of housekeeping items. If you'd like to ask a question during the presentation, just be sure to use the question feature that's found on the right side of your screen, and we'll be happy to answer those. If you're interested in earning 1 CU, just be sure to stick around to the very end. A code will be given, and you'll need to email that to me. If you're watching this at a later date, perhaps on our YouTube channel, we only give out CUs for attending live webinars. And if you're watching as a group, each person will need to email me individually. As I mentioned, this webinar is being recorded. In a week or so, we'll have it uploaded to our YouTube channel. And if this is a topic that you're particularly interested in, or other trainings or information around children and trauma, be sure to check out our Facebook page. We post frequently about that and upcoming opportunities. Okay, I'm going to introduce our speaker a little bit. Nikki Edge has a background in educational psychology and research and is an associate professor in the University of Arkansas for Medical Sciences in the Department of Family and Preventive Medicine. Dr. Edge conducts research on factors that place children at risk for poor social and emotional outcomes and designs and evaluates interventions for these high-risk children and families. Her specific area of focus include children and families impacted by maternal substance abuse, depression and traumatic events such as abuse or neglect, and she has published widely in these areas. She also focuses on interventions in early care and education settings designed to build social and emotional skills in young children. Dr. Edge is also the director of an early childhood mental health consultation program in Arkansas called PreK, as well as a teacher and a trainer and coaching program called REACH. Dr. Edge is also on the board of the Arkansas Association for Infant Mental Health, and I've known Dr. Edge for a number of years, and I can tell you that she is definitely a leader in the field of early childhood education and mental health, and she's somebody that you should know if you're connected. So I'm really excited about our presentation with her today, and with that, I'm going to turn the controls and webinar over to her.
Thank you, Chad. Can you hear me okay?
We can hear you fine.
Great. All right. Well, let's get started. So what I want to talk about today is the problem of suspension and expulsions of children birth to 5 nationally and in Arkansas, and why it is that we're working so hard to try to avoid that. We're going to introduce you to something called the teaching pyramid model, which is a framework that we use in the world of early care and education to think about how we can prevent and manage challenging behaviors in young children so that we can reduce classroom practices where we exclude children by suspending or expelling. And then we'll spend some time at the end talking about new policies here in Arkansas, how Arkansas is really leading the nation in efforts to prevent suspension and expulsion of young ones, and a new support system that is available to all of us when we encounter a young child who might be at risk for expulsion. So first of all, just kind of to frame the scope of the problem, as you all know, the learning of young children takes place primarily in relationships. It's their moment-to-moment interactions with their caregivers and peers in which all learning develops, in which social and emotional learning takes place. So their relationships with all their caregivers, including their child care providers, are really critical to their healthy development. And so one reason that we think about expulsion as so stressful and negative is it speaks to a total breakdown of the relationship between the child and the caregiver. It can be viewed by the child and the parent as a total rejection of the child. It's a break and a permanent parting of ways. And we know that it really sets a child on a strong negative trajectory. So we know that early expulsions are one of the best predictors that we have of later expulsions, and that those later expulsions are our strongest predictors of dropping out of high school, failing a grade, teen pregnancy, teen substance use, juvenile delinquency, and incarceration. In fact, I bet a lot of you have heard the term preschool to prison pipeline, and that's really what this issue is all about. In our state division of child care and early childhood education, we have a manager who always tells a story about her time working for the Department of Ed. And every year she would get a call from the Department of Corrections, and they would ask her how many second graders had been suspended and expelled that year. And she would look up the data and she would provide it to them, and they would call her the next year and they would ask her the same question. And finally, after this happened several years in a row, she said, "Why do you always ask me this question? Why do you want to know about suspension and expulsion of second graders?" And they said, "Well, that's how we know how to plan our prison beds for 10 and 15 years down the line." So, you know, this is not speculative. This really is the preschool to prison pipeline, and we're working hard in Arkansas to try to cut off that pipeline. Let's talk a little bit about definitions. What do I mean when I talk about expulsion? What do I mean when I talk about suspension? So it was a surprise to me that there's not necessarily one definition of expulsion. Different school districts define it in different ways. Some school districts define expulsion as what I would think of as a long suspension, like being suspended for 5 or 10 days. But when I use that term, I'm speaking about permanent dismissal from a program. You may also hear the term soft expulsion. We use that term to describe situations where early care and education program creates a situation that makes it very difficult for the parent to keep the child enrolled. For example, if a program calls you every day to discuss your child's misbehavior, or you have to pick your child up every time they misbehave, then pretty soon you're likely to pull the child out yourself, either because it's disrupting your work or because you begin to worry that your child is no longer wanted or welcome there. And that's not that's not a feeling any parent wants for their child. Then, of course, there's different kinds of suspensions. So just like in K through 12, in the pre-K world, we have part day, full day, and at home or in school suspensions. So we talk about a part day suspension as most typically when you have to get that call and you have to pick your child up because of misbehavior. The full day suspension would occur when the program tells you this is what happened today. They really can't come back tomorrow because of that. They can come back on Friday or next Wednesday or whatever the case may be. We also have, we kind of jokingly talk about it as in-school suspensions for very young children, and that's typically when the teacher just doesn't know what to do and she sends the child to the director's office. And so often that can be unintentionally quite rewarding for the child when they get to do things like, make copies on the fancy copier. All of those practices, though, are practices that we are trying to reduce the frequency of. And it's really important for us to think about these practices in the context of what we know about child development. So sometimes we're engaging in practices that exclude kids from our classrooms, even when we know it can't be helpful because of where the child is developmentally. So a good example of that is toddler biting. So it's in Arkansas historically, it's been very
Nikki, I think we lost you there. Are you still there?
Can you hear me?
Yes.
Okay. I don't know what happened. Where did I cut off?
You were just about to give an example of toddlers and biting. Okay,
great. Yeah, so in many of our programs, we're pretty quick to suspend or expel toddlers when they've bitten multiple times. even though we know biting is pretty normal for toddlers, especially when they're in group care settings. It's a typical behavior that we can expect to see happen. And a response of suspension or expulsion really makes very little sense. A toddler who gets sent home for biting or who has to stay home for a day is not able to connect that consequence to the biting behavior. They're not cognitively able to make that connection. They have no idea that what I did just now is connected to the fact that I have to stay home tomorrow. So it's really ends up unintentionally being a punishment for the parent who then has to leave work. And that's also pointless because there's very little that the parent can do to prevent biting in the classroom in which they're not even present. So, I think it can help us to think about, what a child understands developmentally and what a parent has the capacity to help with and doesn't have the capacity to help with, as we think about needing to limit some of these practices. So the other thing that I want to mention is that we don't typically use the words expulsion and suspension in early care and education. So I'm using them today. We're trying to, to put it on the table, but that's not what a teacher or a director is going to say to a parent. You're not going to get a note home saying your child has been expelled. What you're going to hear is that we need you to pick them up. We think that your child would be better off in a different kind of child care setting. We think it would be best if you kept them home until there can be some help. And our intentions might be very good, and we might really want the family to get help, but the bottom line for the parent or child is still the same. The child who most needs support in becoming school ready is still excluded from the classroom, and the parent is excluded from the workplace. So let's talk a little bit about how often this happens and how it compares to what happens in kindergarten through 12th grade. So the work of Walter Gilliam, who first began studying this issue about 10 years ago, kind of shocked us all and told us that in K through 12, kids are expelled at a rate of about 2 children per 1,000. And his studies revealed that in our publicly funded pre-K programs, so in Arkansas that would be something like our ABC, Arkansas Better Chance program, the rate is triple. So it's almost 7 kids per 1,000. And then further, in the world of private licensed child care, so not your state-funded pre-K, but your child care, your local child care center down the corner from you, the rates are astronomically higher, so about 13 times the rates of suspensions and expulsions of K through 12th graders, so it's 27 per 1,000. And this is really disturbing to us. We know that the reason kids are expelled at such a low rate in K through 12 is that we all understand the importance of keeping kids in the learning environment. We know we can't have them be successful in school and in life if they're excluded from that environment, and we do everything we can to put protections in place to keep them there if at all possible. And so the same should be true in our early care and education settings. We can't claim that our pre-K system will get kids school ready if we're expelling the very kids who need our help the most. This map just shows, it's the last data that we have nationally and kind of shows where Arkansas is on this issue relative to other states in our state-funded pre-K systems only. So not our whole universe of early care and education programs, but our state pre-K. And basically just we're in the green, and that tells you that we're sort of in the middle of the pack. We're not leading and we're not the worst on this issue either. But we still have a long way to go. In Arkansas, we wanted to understand more about what is happening, how big of an issue this is for our providers, especially our private providers and our providers that accept state and federal funds. So in Arkansas, we have what we call voucher providers, meaning that providers take federal funds to support the care of some children in their setting. We're also interested in the practices of our state-funded pre-K providers. And what we know now from our surveys in the past year, and we've got data on about 500 programs, is that most programs have recently been calling parents about children's behavior. That in the past year, 43% of them have either suspended or expelled a child, and 9% have gone that final step of requiring a permanent dismissal of a child. Obviously, we're pleased that permanent expulsions are less common, and this does put us at about the national average. This is pretty consistent with what we're seeing in other states. Who gets suspended, who gets expelled, who's at most risk? Let's talk about that. So what we know is that age, gender, and ethnicity help drive who is suspended and expelled the most. So we know that boys make up about 3 out of 4 preschool suspensions, and that the older you are in pre-K, the more likely you are to be expelled. Sort of the bigger you are, the more we tend to have high expectations for your behavior and might expect you to be able to function like you're a kindergartner, even though you're not developmentally there yet. We do see that our African American young children are at highest risk of both suspension and expulsion. You can see there's actually a typo in the second bullet on this slide. This is referring to African American young children who make up 18% of preschool enrollment and almost half of preschool children with multiple suspensions. So Walter Gilliam, who's one of our premier researchers on this topic, tells us these are not additive risk factors, they're multiplicative when you start to put them together. So a 4-year-old African American boy is exponentially more at risk for expulsion than a white or Asian 3-year-old girl, for example. There's a lot of reasons for this, and one that you'll be starting to hear more talk about, I think, in both the media and in the world of research, is implicit bias. So those biases that we may not even be aware that we have, but that kind of shape the lens through which we view the world, including young children. And we're learning now more about how that plays out in preschool settings. So those are kind of the kids who are most at risk, but there's also setting features that make it more likely a child will or won't get expelled. So our private or faith-based programs are less likely to have formal regulations that limit suspension and expulsion. Some of our state-funded programs are more likely to have those kind of regulations. Head Start has led the way in this regard, and they have long had regulations that limit expulsion and suspension. We know that extended day programs have about triple the expulsion rate as part-day programs. We know that high teacher-child ratios are associated with expulsion. All these sort of speak to stress of teachers. If the day is long, if there's really not enough teachers to adequately cover the children, then it becomes very difficult to manage challenging behaviors. Another one I want to point out is that teacher stress and feelings of hopelessness. So if a teacher begins to feel that the situation isn't likely to get better, or that the parents aren't going to be able to partner with her to really help shape the child's behavior both at home and in school, then expulsion is much more likely. So one thing all of us can do is try to lend our hope to the teacher and try to help our teachers be aware that there is hope, there is help, and that there are things we can do to improve the situation. Teacher and parent relationships are key here. So most teachers will tell you they don't expel kids, they expel parents. So kids, the research confirms this, kids don't usually get expelled when there's a good working relationship between the teacher and the parent. So one thing that we really spend a lot of time talking with teachers about is how they cultivate strong relationships with the parents from the very beginning so that they have a relationship in place when they need to have harder conversations about behavior that's happening in the classroom. And so this is, again, one of those places where we all have a role, we all have a part we can do even as parents. So as parents, what we can do to reduce the likelihood that our child will get excluded from the classroom because of behavior is we can connect. We can take time to connect with the teacher. We can keep our cell phone in our purse or leave it in the car when we walk in the classroom. We can, I know for me, I was always rushing to get to school on time, needing to get to the grocery store after work. It's hard to find time to just stop and check in with the teacher. How are things going? How was today? And start to find those daily ways to build that relationship. So let's talk a little bit about the kinds of behaviors that we know young children are being suspended or expelled for. So we know that if an infant gets suspended or expelled, it's going to be typically because they're inconsolable, that we can't find a way to soothe or manage their upset. We've already talked a little bit about toddler biting. Biting is going to be the biggest reason that we see that toddlers are going to be expelled from our early care and education settings. And then after that, it's really your aggressive and sort of non-compliant behaviors. And then behaviors that might not be dangerous, but that are awfully upsetting or just gross to teachers, or that upset parents. So spitting is one that concerns teachers a great deal. Children cursing troubles teachers a great deal. And again, this is a place where we all have a role to play. So a teacher might not be as upset about a child cursing in her classroom if she wasn't as worried about what will parents think. What will parents think if their child comes home having learned a new word in my classroom? And that can feel terrible to the teacher. So as parents, we can be understanding. We can let the teacher know that we know these things happen. And we don't want to pressure her to exclude a child from the classroom because they happen to have taught our child an unpleasant new word. So one thing we know from just the data is that most classrooms are likely to have a child with very difficult behavior in it. That's just what the odds are. So when we have done universal screening in our programs in Arkansas, we find about 16% have clinically elevated behavior concerns. We actually just got a new study released from the CDC that tells us that Arkansas has the highest rate, tied with Kentucky, of young children 2 to 8 with diagnosed emotional, behavioral, or developmental disorders, and that's 21.5% of kids. So odds are every teacher is going to have 1 or 2 kids that are really challenging for them to manage. And I do want to just acknowledge the hard reality for teachers. These behaviors can be very difficult to manage. They can be very disruptive. It is very difficult for a teacher to manage 12 children in her classroom when one of them is getting aggressive with other children and she's constantly having to monitor and attend. It can make the teacher really question her skill set, really question what she knows to be effective, not knowing why isn't this working with this child the way it typically works for other children. And it can anger parents. And again, this is all of our role, is to be the kind of parent that makes room for the fact that in my child's classroom, there's going to be a child that's struggling. In a group care setting, things are going to happen. There might be a time my child gets hit or pushed or kicked. It doesn't mean that it's an ineffective teacher, and we need to dialogue with the teacher and make sure that she knows she has our support. We don't want to be pressuring our teachers to find the quick fix. So too often the quick fix is to exclude the child who was aggressive from the classroom, and that's not going to solve any of our problems in the long term. These children are going to be in our child's kindergarten class. They won't be able to be expelled there. So better for us to find the ways to deal with it when they're 2 and 3 and 4 and the behavior is easier to address. So we're going to switch gears and talk a little bit about some of the strategies that we use to help teachers know what to do, to learn strategies, to sort of set up a classroom environment that supports the kind of behavior we want kids to have. But I will pause there just for a moment before we kind of shift gears there and just ask if there's any questions about what we've covered so far.
So yeah, so just as a reminder, if you would like to ask a question, just go ahead and type that to us, and we'll be happy to answer that. I know a question that frequently comes up, Dr. Edge, is will we be able to share this PowerPoint to the group?
Yes, absolutely. I can, but yeah, however you normally share that, if you want to email that out, whatever you want to do, that's fine.
Okay. I'm not seeing any questions coming in at the moment.
Yeah, I don't see any questions yet, but you know, be thinking on those, and we'll allow some time at the end.
Oh, we have a couple of questions just came in. So this person asked, just to be clear, Arkansas has the highest rate of children diagnosed with social and emotional disorders.
Yeah, so according to a new Centers for Disease Control study, a survey of parents that asked about diagnosed concerns, Arkansas was tied with Kentucky for the highest rate, and it was 21.5%. And I'd be happy to share that a link to that study if you want to, shoot Chad or I an email and share your contact information.
And then just one other question that came in. This individual asked what you think about in-school suspensions, and maybe that individual can kind of elaborate on that. I'm not sure if that's with regard to the early pre-K, what we're talking about, or just school settings. But
I'll address it in the pre-K setting. You know, what we really want to help equip teachers to do is to manage the behavior in the classroom. We want teachers to sort of, not give away their power and their authority. We want them to find ways to stay connected to the child, to build the skills of the child, and to manage it in the classroom so that the child can stay in the learning environment and not be ending up spending their time in an office, which is not going to teach them any of the skills that we need them to learn. So that is any form of sort of in-school suspension in the pre-K world we're going to, discourage.
Okay, I think that's all the questions for now.
Okay. So I want to introduce you, if you haven't seen it already, to the teaching pyramid model. So in our world of early care and education, we have federal guidance from the Department of Education and the Administration for Children and Families that recommends this is how we think about developing a workforce that's well prepared to handle children with challenging behaviors. They want us to focus on these kinds of supports, this way of thinking about working with young children. So this model really walks us through what we need to do in our whole environment to support kids and reduce the likelihood that challenging behaviors are going to get out of control. So it reminds us that most of the responsibility lies with us adults, the environment that we create, the relationships that we develop, both with children and adults, the direct teaching that we do to address gaps in children's social and emotional skills. This model tells us that when we do those things well, that will take care of about 95% of the behavior concerns that would have been brewing in our classroom. So we really emphasize this model isn't about fixing the child, it's about fixing the environment to support all children. And then this model acknowledges that there will still be that occasional child that needs additional support, and that we have a process and ways to get help. We know how to track behavior, figure out the meaning behind the behavior, and get support so we can develop an effective plan. So I'm just going to briefly walk you through each level of the pyramid and share a few examples of how we use it to support all kids, including kids who are having a difficult time with behavior. So you're going to see that this was developed for the world of early care and education, but it is easily transferable to the home environment. I think about this in my home as I was raising my child all the time. These are supports that should be present in any environment in which children are being served. So let's talk about that bottom layer of the pyramid. If you look at that bottom layer, you can see that that is nurturing and responsive environments. And so this level of the pyramid is really about setting the stage for good behavior by building nurturing relationships with children in the classroom. So those of you who have worked in early childhood know that children's relationships with caring adults lay the foundation for healthy development, all aspects of development, including social and emotional and behavior development. So what are the kind of things that we work on with teachers? One thing that we work on is being consistently responsive to young children's needs, physical needs and emotional ones. So we work with teachers to know that we know it's hard. We know that when there's 6 infants that you're responsible for or 12 toddlers that you're responsible for, this can be difficult. But we want our programs to be staffed in a way that we can quickly respond to children's needs. If they're crying, we want to be right there to soothe. We don't want to see if they can cry it out. If there's a dirty diaper, we want to get that taken care of as quickly as we can. If there's a hurt feeling, if there's a sadness, if I'm sad because my mom just left me in the preschool classroom or in the toddler room, then we're attending quickly and soothing. We also really work hard to teach teachers about the power of positive attention, and that you generally get more of whatever behavior you give your attention to. So we help our teachers understand that if a child needs attention, if they're not getting the attention that all children need, then they're going to be willing to accept any kind of attention, even negative attention, even a reprimand, even harsh words. So if you give your attention to something, you're more likely to get more of it. If you tell your 4-year-old boy in your classroom that you notice how carefully they're stacking the blocks and building their block tower, then you're likely to get more block stacking and less block throwing. If you give a lot of attention to behaviors you don't want, you're likely to actually exacerbate those behaviors. So notice what's going right in the classroom and place your attention there. We also spend a lot of time talking with our teachers about the power of joining in play. So one thing we discuss with them is how many of our mental health interventions, our evidence-based mental health interventions like parent-child interaction therapy, for example, mental health interventions for kids with diagnosed behavior concerns start by teaching the parent how to play with their children for about 10 minutes a day in a particular way that really stays focused on the positive actions that the child is taking in play. And so we are encouraging teachers to find that way to connect with their most difficult children, to join them in play, to focus on commenting on anything that they're doing that's appropriate, to follow the child's play lead. These are the things that we want to be going on all day long in preschool classrooms anyway, but we're asking teachers to really think about intentionally doing that with some of the children whose behavior shows us they need it the most. We also talk about building relationships through conversation, both with and respectful interactions, both with children and adults. So how do we engage in the kind of constant conversation with kids and with parents that lets them know we're interested? We're interested in learning more about them. We're interested in what they did this weekend. We're interested in what they like and what they don't like. We're interested in learning more because we care. And that really kind of sets the foundation for a positive relationship that will help us weather tough times that might come in the classroom. So I think it's easy for you guys to see how these are not just classroom strategies. These are great, foundational things for a good home life as well. And so that's one of the things we always want to keep in mind is how do we spend our time thinking about how to create consistency between home and school? How do we share with parents what's really working in the classroom that they can do at home as well? So then next you can see that the next layer up is the high quality supportive environment. And so this is about the stuff in the classroom and about the daily activities, the schedule, and routines of the day. So again, this is an area that we look at closely when we have children with behavior concerns. We're looking to see what's going on in the classroom. What are the schedules and routines like? Are there trouble spots? Are there times in the day when we're asking something of children that's really not developmentally appropriate for them? So some of the things that we look at are a consistent and predictable daily schedule in words and pictures that is taught to the children every day so that they always understand where they are in the day, what's coming next, what's about to happen. Predictability and good routines really supports the kind of behavior we want to see in children. We want to see large hunks of the day dedicated to child-directed play. And teachers are engaging in that play, and they're expanding on the children's play, but letting the children take the lead. This is the best way that children learn. This is a place where we all can play a role, too, because when we have centers where this goes off track and where parents are expecting to see certain kinds of proof that their children has learned, often the proof that parents are looking for is something that's not really developmentally appropriate for children. So we don't want to see worksheets coming home from our 3- or 4-year-old. We don't want to see art projects that all have to look like the teachers. This is not how children learn best. Children learn best through hands-on activities and deep and extended play. So some of the other things that we look for are that group activities are short and engaging. We shouldn't be forcing kids to participate in what we call like circle time, for example. It should be engaging enough that they want to participate, and we shouldn't try to outlive their attention span. So those are all kinds of things that we work to help teachers identify any areas where there are just trouble spots in the day where behavior tends to become concerning. So kind of moving on up the pyramid, you get to targeted social and emotional supports. And so here, we're really trying to help teachers and parents understand that kids don't learn social and emotional skills just by osmosis. Now, they are going to pick up a lot of skills just by how we model those skills. But just like we're going to have to teach kids how to read, we're going to have to teach them how to tie their shoe, we are going to have to teach them social and emotional skills. We're going to have to teach them how to ask to play, how to say what they're feeling instead of hitting, how to calm down when they're upset, how to say, I don't like that, instead of becoming aggressive. And these are things that have to be taught and practiced over and over and over and over in the classroom. So we work with teachers on all the things you see here on the screen. What are the different ways that they can teach feelings? What are the different ways that they can teach and model problem solving, modeling friendship skills? And this really starts, all of this really starts in infancy. So even our infant room teachers can be naming feelings that babies are experiencing and starting to build those social and emotional skills very early on. So continuing our move up the pyramid, we get to the top, which is the level of individualized or intensive interventions. And what we know is that if we're working the rest of the pyramid well, then individual intensive interventions should not be needed nearly as often. And that when we get to this level, we're really talking about really trying to understand and track and monitor the behavior that's concerning us, and then working with a team to develop a plan to support the child in learning a new behavior. Parents should always be involved at this level, and then we want our programs to have access to supports. And I'll talk a lot more about the supports that are kind of newly available in our state. So we want support teams within early care and education settings. And in some of our larger early care and education settings, there are lots of supports. There might be a mental health or disability specialist on site. There might be, just a skilled senior mentor kind of teacher or a director that can provide guidance. Technical assistance. We have teams of really wonderful folks in our state that are experts in developmentally appropriate practices and in social emotional supports in classrooms that can come out and offer a hand. We want to make sure that we're always thinking about the developmental needs of kids. Is there something going on developmentally, a delay or a concern that is contributing to the behavior, and making sure we're partnering with our early childhood special ed colleagues. And then mental health consultation is available in our state too when the problems really require a trained mental health professional to kind of pair up with a teacher and come up with some new ideas or strategies that the teacher can try. I want to spend just a couple of minutes talking a little bit about mental health consultation, because it is a resource that not everyone is aware of or understands. And what I really want to emphasize here is that these are not, mental health consultation services are not therapy services. So we want teachers to understand and parents to understand that we can't pull a child out of the classroom and teach them a skill and think it's going to generalize back into the early care and education classroom. So kids learn their social and emotional skills best in their moment-to-moment interactions with teachers and parents and other kids. So our goal is to help the teachers learn how to be effective in those everyday moments that they have with the children day in and day out. How do they be effective in those moments to build the skills that are going to support the child? And that's going to be so much more effective than what we could do in 30 minutes of therapy. So our goals you can see on your screen, but they're really about helping teachers think about what are the strategies that they can use at each level of the pyramid that we've talked about to support a child. So lots of observation, lots of information gathering, and helping the teacher really brainstorm some things that they could try, that they'd like to try, and then supporting the teacher in implementing that. That might be talking them through it might be modeling it might be a little bit of coaching. We also try to learn more about home life and what the parents are seeing and experiencing, what needs they have, and find out if there are referrals and other supports that need to be brought together, and really kind of trying to promote some consistency between school and home. So that's kind of what mental health consultation is all about. And in Arkansas, our mental health consultation program is called Project Play. If you want to learn more about the pyramid model and how that works, our state Division of Child Care and Early Childhood Education generously partnered with Naptime Academy to develop a series of online courses that really walk you up the pyramid in much more depth and detail than I did today. And so these courses are available at no cost to any early care and education provider in Arkansas, and at a small cost to other kinds of professionals. So I'm going to shift gears now and spend our last few minutes talking about new policies and supports that are available in Arkansas so that you can help teachers and parents get connected to the supports that they need when you encounter families that might need support. So about a year and a half ago, some new federal guidance came down from Department of Ed and Administration on Children and Families that said states have got to make a plan to reduce suspension and expulsion and build social and emotional skills of young children. So Arkansas put together a multidisciplinary work group that began meeting to sort of figure out what steps could be taken. So this work group included professionals from across our Division of Child Care, as well as professional development contractors, mental health consultants, and others that work with young kids, such as our early childhood special ed colleagues. That work resulted in some new policy and some new support systems being launched. So just to provide you with a little bit of background about what had existed in Arkansas to limit suspension and expulsion, we had two long-standing policies. So Head Start, if you're familiar with the federally funded Head Start program, they have had a long-standing expulsion prevention policy. So they are essentially not allowed to expel children. And our Arkansas Better Chance state-funded pre-K programs had a long-standing policy that limited suspension and expulsion for enrolled children. However, we knew that there were opportunities to strengthen both the monitoring and the support efforts, even in those programs that had a long-standing policy. And then our State Division of Child Care decided that they really want to enhance consistency across all of the kinds of early care and education programs that they fund. And so in July 1, a new policy launched for early care and education programs that accept child care vouchers for the care of children. And that policy essentially says you may not expel a child without seeking help and getting permission from the Division of Child Care. So between those policies, the policies in ABC, the policy for our voucher providers, and the policy in Head Start, about 75% of early care and education providers in Arkansas are now covered under a non-expulsion or an expulsion prevention policy. Then we launched a new support system on July 1 called BehaviorHelp. This system is not just for the providers I've been describing, it's for any early care and education provider. So whether they're under the policy or whether they voluntarily want to use this support, it's available to them. And I'm just going to briefly sort of describe this support and how it works. So BehaviorHelp is really a single point of entry for getting help related to serious behavior problems that are happening in a child care classroom. The purpose is, as you know, probably obvious by now, it's to reduce suspensions and expulsions. So the system starts with an online, very brief help request. Anyone can submit this help request. Whoever submits it will receive a phone call within a couple of working days from a Division of Child Care and Early Childhood Education BehaviorHelp specialist. They're going to complete an interview with you with questions about the situation that are going to give them the information they need to figure out what would be a most helpful next step. So from there, we kind of triage the concerns. So the behavior specialist might decide that they have resources that they can share that might help manage the situation. So if a teacher calls in and she has a toddler that's biting, and this sounds pretty much like developmentally normal toddler biting, then the specialist might just share information, talk her through what to do when children bite, share a handout on toddler biting, share a handout on you know, what you can share with parents about how to manage toddler biting, and then arrange a time to check back and see how that's working. Sometimes it's a little more complicated or a little bit unclear, you know, what's driving the behavior or what would be helpful, and someone needs to go into the classroom and take a look and see what could be helpful in supporting the teacher. So if the behavior is a little more serious, or the teacher is pretty, you know, she's really tried everything and her frustration is high, then we have a team of technical assistance providers that are available through Arkansas State University that are experts in developmentally appropriate practice and social emotional classroom supports. And they can go out and do short-term technical assistance, give the teacher some ideas, try to notice some of those opportunities in the classroom that we talked about earlier in the webinar, to kind of reduce some of those trouble spots in the day, and, you know, help the teacher identify just some strategies to try. If the call comes in and the behavior is extremely frequent and extreme, and or there is an identified trauma history or sort of already a child that's multi-system involved, there's foster care involvement, you know, whatever the case may be, this case seems fairly complex, the behavior might be driven by trauma, then that's going to come automatically to Project Play to a mental health consultant. And then, as you can kind of see along the side, all along the way, our state Division of Child Care sponsors a whole array of teacher trainings in the social and emotional development domain that are free to teachers and we can sort of assess their needs and help them develop an individualized training plan. The piece that's not on this slide are our partners at Early Childhood Special Ed, with whom we'll be working increasingly closely. They can access BehaviorHelp when we need to partner around a child that has identified developmental concerns. And then also they have behavior specialists. Many of our educational cooperatives have behavior specialists who can also be helpful to this system. So that's the BehaviorHelp system in a nutshell. I will say that our mental health consultation capacity is growing, and we have trained and working consultants on the map. You can see that it's not everywhere, but it has been growing. But just wanted you to be able to see that there are parts of the state in which that resource is more difficult to access. I also just wanted to emphasize that, again, we all have a role to play. We can refer into the system, any of us, whether you're a mental health professional, whether you're a foster care caseworker, whether you're a family member, whether you're a teacher. Regardless of what kind of program your child is in, you can generate a help request. This is where you can get more information. That long sort of website at the bottom is where you find the help request form and where you can find some frequently asked questions and other things. I'm going to move a little quickly through the last bit here just to tell you a little bit of what we're seeing. So we're seeing our referrals into the system increase exponentially. October is on track to outpace September. I just didn't have the bulk of that data when I created this slide. The children that we're seeing referred into the system are similar to what we know is, our children at risk nationally, so our older kids more likely than our youngest. Our boys are the majority, just similar to the national trends. And the behaviors range, but almost always consist of aggressive behavior, hurting others, and difficulty following routines and paying attention are some of the sort of other most common behaviors. But you can see that the range of behaviors is great. I also wanted to note the connection to trauma that we're already seeing in our early referrals. So without even screening for trauma in any systematic way, when our interviewers ask the question, is there anything that you think we should know about this child, or do you know of anything that's been going on at home that might be contributing, we get difficult or traumatic events in 33% of cases that we have had so far. Ranging from the not, unexpected divorce to extreme and just really distressing cases of abuse, neglect, grief, and loss. So we know that that's driving the behavior, and so we're really looking at this issue of trauma, creating, a workforce that is more trauma-informed, and classrooms that are more sort of sensitive and responsive to this issue. So some of our successes are that we've seen so far. Utilization has certainly outpaced our expectations. We've seen a lot of wonderful partnerships and coordination of services to sort of, as we've sort of aligned resources under this BehaviorHelp system, and so those have all been really positive. One challenge that I want to mention to this group in particular, because I know we have a lot of mental health professionals on the call, we are already seeing, as I mentioned, this volume of referrals for kids with pretty significant experiences of trauma, pretty significant behaviors, and we have a great need for referral partners, providers that are trained in the evidence-based treatments for young children. treatments like child-parent psychotherapy, parent-child interaction therapy, trauma-focused CBT. There are parts of the state where we're having trouble getting kids that need more than classroom support to the supports that they need. And so that's going to be, kind of an ongoing conversation between us all. And I think I'm going to try to stop there. And I'm just going to leave you with this lovely quote. This has been our mantra, that none of us can do it alone. A teacher can't do it alone. A parent can't do it alone. It's going to take a team of us, but together we believe that we can support any young child in Arkansas. And I'll leave it there, and we've got just a few minutes for questions if you've got some questions about what we've covered.
Okay, thank you so much for a very informative presentation. So we do have a number of questions that came in, and just interest of time, I'm going to just display the CU information up there. So again, if this is something you want to get CU credit for, just be sure to email me with the code that's there. And it's helpful if you tell me your first and last name. That just helps me out. But we do have a couple of questions. One is kind of sort of back at the earlier part of your presentation. Could you just expand a little bit more about why faith-based and or private schools contribute to the risk?
Yeah, it's really just a matter of lack of sort of systematic policies or rules that limit that in those settings. So our federally funded programs like Head Start or our state-funded programs like Arkansas Better Chance have had policies in place in the past and currently that at least have limited these things. We didn't have the full-blown support system that we have today, but there were at least some practices in place that tried to make it more of a last resort. And if there have not been those strings attached to the federal or state funding, then it would be up to a private program to just sort of voluntarily adopt non-expulsion policies, and that is less of a common practice in Arkansas and around the nation.
Okay. And do you know if it's illegal for a child with a 504 IEP to be expelled? Is there anything on that, or?
I'm not going to pretend to be an expert in that, and I'm not going to address what's illegal, but we do know that, when a child is under an IEP, then they have, even far beyond what we've talked about today, there are rights and protections in place, and we would call on our colleagues in early childhood special ed to help answer, those questions on a case-by-case basis, but it does offer definite additional protections.
Okay, and probably maybe like one or two more questions. And so we have some very interested mental health therapists out there that want to partner. So what would be the best way of them helping out, or how would they get connected to Project Play or to you? What's the best way to do that, Nikki?
So emailing me is a great way to get connected, and Chad, if you email Chad on the email on the screen, he can forward that. Whenever we do our training for Project Play mental health consultants, we typically open that up to others in the community that are not funded through Project Play but that want to learn more about working with young children or about consultation models. This will be only a growing need in our state, and we'd love to have you join our Project Play consultant training. And then if you are someone who's trained in an evidence-based practice and working with young children, we want to know about you. We're going to be sort of looking for those referral partners in all of our communities, so we want to make sure we've got your contact information.
Okay, and I'm just going to end with one final question here, and if we didn't get to your question right now, I will forward those on to Dr. Edge, and she'll be able to answer those for you. But are there any trainings, and maybe this is what Project Play does or doesn't do, that that can, okay, I'll just read the full question here. Are there any trainings that will come to child care centers for parent meetings at the center that center on child behavior, So perhaps the same trainings for teachers receive that parents can do at home?
Yes. So, if we have a child care program that thinks that they can get some of their parents together to share information, then there are a number of contractors that do professional development for teachers funded through the Division of Child Care, but that are often willing to come and do a session for parents on some of these topics. So I know here in UAMS, we have Project Play consultants that will do that. We have a program called REACH that will, be able to go and kind of help with a parent meeting from time to time. So then there are other resources as well. So we could sort of assess your needs and look at your location and kind of figure out who might be able to help.
Okay, thank you. And I know we're at the top of the hour and folks have to get on with their day, but like I said, I will forward the remaining questions on to Dr. Edge and hopefully we'll be able to answer those. Hopefully you enjoyed the presentation today, and we'll have another one next month, November. So just kind of be on the lookout for that. Again, checking our Facebook page, or if you want to receive announcements about webinars, you can just let me know in the email. Send me an email. I'll be happy to add you to our list. So hope everyone has a great day, and thank you, Dr. Edge, for doing this for us.
Thank you for organizing us, Chad.
Okay, everyone take care.